Welcome to Healthcare Signs and Symptoms, a show where we explore the interdisciplinary field of healthcare and medical research. Tune into our bi weekly conversations with UOHS as we cover the latest topics in science and healthcare news. My name is Nicole Chu, and today I'm joined with Tanya Lee.
So today we'll be talking about gyms and obesity, but before we get started, we're just gonna make a disclaimer that we're not experts. We're just undergraduate science students, and we're having an open and educated conversation on different topics in science that we believe should be addressed. So to begin with our conversation, we're just gonna start with obesity, because obesity and being overweight or obese is defined as an abnormal or excessive fat accumulation. That's a health risk. um, a BMI over 25 is considered overweight, and 30 is obese. So they're being overweight and being obese is different.
Yeah, certainly. And obesity definitely has multiple health risks associated with it. For instance, an elevation of several non communicable diseases, including type 2 diabetes, coronary heart disease, strokes, and several cancers. And many people may think that obesity is only associated with non-developing countries such as America or European countries, due to like the increase of fast food and money to enable people to buy food. However, we've been seeing a trend of increasing obesity in developing countries and low income countries as well, due to this being a form of malnutrition because people in developing countries don't have enough money to spend on getting adequate nutrition because meats and vegetables are expensive, right? They don't have that extra money to spend on their health. Therefore, they rely on fast food, and that often causes obesity.
I feel like a big problem is some people think like obesity is just like people just not eating healthy, and a lot of people are like, oh, why can't you control it and stuff. But I feel like most of the time it's not really the person's fault. It's like not no one really chooses to be unhealthy or make these bad life decisions most of the time. It's just sometimes it's the only food that's available just because they can't afford anything else.
Yeah, definitely. And there's also that time constraint, right? For instance, in like low income households, there's probably not that luxury of like having excess time to spend to like cook really healthy and nutritiously balanced meals. They often have to resort to like either McDonald's or like those 1 minute microwavable meals because they probably work multiple jobs and they don't have that time to spend on like nutritional well being.
And I just feel like different people gain weight differently. Like some people gain weight more easily than others. So I feel like the whole shaming culture on people who are obese or overweight is not really, it's not fair most of the time to them, just because they're not trying to do that to themselves most of the time. Sometimes eating is a coping mechanism for stress. Sometimes their body just makes it really hard for them to lose weight, and it's not their fault.
Yeah, there are definitely tons of genetic factors in that come into play. And according to the World Health Organization, just to give you guys some statistics, in 2019, 38.3 million children under 5 were obese. And as of 2016, 38% of the adults in America were overweight and 16% were obese. So there's definitely been like increasing numbers of obese individuals in the world. And I think definitely quarantine has added to this because there's definitely been like less opportunities for individuals to go outside and to go exercise. And there's been lots of time spent inside, just like on the couch, not really exercising.
Quarantine really just brings down the motivation to go outside, because you might maybe on before quarantine you could be like, oh, I can take a morning walk, like it's good for me and stuff, or I can go with my friend and we'll go jogging together. But with COVID, it's kind of hard because you might just not want to do it. Like you won't have the motivation because you're like, oh, what if I'm putting people at risk, or I don't want to do it with other people because I might put them at risk. But at the same time, I don't really have the will inside me to do it by myself. Like I definitely feel that sometimes, where I'll only really go with outside if it's with my roommate or something, or if it's with a friend. But I wouldn't really do it on my own just because I don't have that motivation.
Yeah, definitely, like, I remember pre-COVID and pre-quarantine, there's definitely, like, a lot more opportunities to go outside without having to worry about, like, wearing a mask or getting contracted with COVID-19. However, now with COVID, like, there's always, like, a risk of leaving my house, right? Like, even going to the grocery store or taking, like, a five-minute walk outside, since COVID-19 is an airborne disease and is really, really easy contracted, then I feel like it's always safer to stay inside, and that's definitely, like, lowered my motivation to, like, go to the gym or, like, exercise outside.
Mhm.
Mhm.
Especially with like stage two, that's happened recently in Ottawa because of our second wave and the spiking cases. I think it was like October 10th, where like Ottawa, GTA, like Toronto, Peel, York, they were all ordered to close like a bunch of different places, like gyms, so less of an opportunity to work out and do exercise. But um I think casinos were also closed as well. Indoor cinemas, performing art places, indoor restaurants, dine-in, conference centers, except for courts. And they reduced the gathering limit to 10 people indoors and 25 people outdoors. So I guess I've noticed that if I go to like a restaurant for takeout, then they do have like a limit of people who can go in. And there's usually an employee that monitors it.
Yeah, certainly. And I feel like that's also impacted many people who depend on gyms as a source of exercise because of COVID. Like, gyms are actually a pretty dangerous place to contract the sickness. And the reasons for this are that since COVID is an airborne transmissible illness, small droplets can remain in like an area for a really, really long time and for extended periods of time. Therefore, many gyms and facilities such as Good Life or like yoga studios, they don't have the rapid like technology that can circulate air, so often if, like, people are going to gyms, they often work out for, like, at least 30 minutes, right? And during that time, none of the air is being circulated. You're breathing the same air as, like, other people who are sharing machines as you. So there's a really high chance that COVID could be easily spread throughout these, like, non-contact, um, sources.
Like when I went to the gym, I think like before COVID like kind of closed it and all, I did notice like not many people wear masks at the gym, and I think there's a case in the Uottawa Minto gym. So a lot of people, like I know a lot of my roommates and different people who live in like the area were planning on going to the university for gyms, but ever since like the COVID cases on campus were confirmed, a lot of people have just been avoiding it just because it is a big risk. People don't really work out with masks, which is understandable.
Yeah.
Yeah,
It's
you're
definitely,
doing
like,
like
kind of understandable to see why people wouldn't want to wear masks when they work out because it is quite suffocating, and the point of, like, wearing masks is to, like, prevent these like, the spread of COVID-19. So that definitely, like, increases the risks of, like, contracting COVID-19 in a gym. And also, like, many people who go to the gym, they're probably, like, pretty healthy individuals, right? Like, they work out regularly, and they probably wouldn't show COVID-19 symptoms even if they had it. Like, they're probably asymptomatic to a degree. Therefore, if they're working out in the same space as you, then it's probably pretty dangerous and you might have a higher possibility of getting COVID-19. And we can see that in a Hamilton example of like a Hamilton Spin Co super spread outbreak where one person went to a Spin Co class, which is like a type of cycling class, and they were asymptomatic, meaning they had no symptoms. And this individual ultimately spread their case to 70 other people. And this didn't only include people in their SpinCo class because like these people from their SpinCo class went to work, they went to school, and it spread to like so many different places through community transition.
it really shows how like just one person can cause so many cases, like just one action.
Yeah, definitely. And community transmission is so hard to control because you really don't know who you've come in contact and who has COVID-19, who doesn't. For instance, like 8 of the cases were transmitted to people in other workplaces, such as in restaurants, in other gyms, in other retail centers. And who knows who these people have come in contact with in the future. Like, you really, really can't control these. And it all started from one spin coat class, which just
I would,
shows. Mhm.
yeah, it just shows how spreading is really easy, just like especially in like a gym setting or like a spin class setting.
Yeah, definitely. And also, if, for example, you went to that spin coat class, you're definitely putting other people more at risk. Like, for instance, if your family had an elder or if you're in contact with someone who had other illnesses, it's definitely making them more vulnerable as well, just because you went to like a spinning cycling class.
Mhm. I
So,
do feel like, oh, go. I was just gonna say, like, I do feel like the asymptomatic part of like COVID is definitely tricky because like it's not like that person had COVID and they decided to go anyway. Like they knew they had COVID and decided to go anyways. They were asymptomatic, which means they probably didn't get tested and just assumed that they didn't have COVID and went and didn't realize that they actually spread it to like 70 other people.
yeah, it's really hard to tell. And I can't even imagine what that one person is feeling like because they just went to a spinning class and they just wanted to, like, I don't know, take 1 hour to better their health, but they ended up spreading an illness to like 70 other people. Personally, I agree with the closing of gyms, but I know that many like fitness workers or people who are gym advocates, they don't agree with Doug Ford's choice of closing gyms and mandating other like gym businesses and fitness businesses to be closed. And we
Mhm.
can see that through like many petitions.
Oh yeah, I have seen petitions like floating around social media and stuff to reopen gyms, and a lot of the arguments were like alcohol stores and stuff are still open and like schools are still open, but they're not allowing gyms to open even though it's a booster for mental health and physical health, especially during quarantine where a lot of people feel like they're alone or isolated and don't really have that outlet of doing exercise. Like not everyone really has that choice of working out at home sometimes.
Yeah, definitely like space and like money is definitely a consideration because gyms for many people is an outlet. Like, for instance, if they're struggling mentally due to anxiety caused by COVID, they rely on gyms as a source of relaxation where it's a safe space that they can go exercise and relieve their stress. However, after the closing of gyms, they often don't have enough space in their household to work out, or they just feel confined inside their home. So definitely mental health is like an important argument for the reopening of gyms.
I know a lot of people just like maybe see it as time to get away from home and also be productive because they're working on their overall health, they're working on their body, but they're also just taking time away and just like I know personally I like to listen to music. I have like a gym playlist and then it's really nice. It's just a change from being stuck at home and working all the time.
Yeah, really that option of having like gyms open just to go once in a while was honestly such a luxury back when there wasn't COVID. Like it was an option, like it was there for us to use it, but I really didn't cherish it enough before like gym closed.
Same. I only recently started to get into like going to the gym like around the time COVID started happening. So it definitely sucked because when I was in first year and second year, I had the option of using like the U Ottawa gyms for free because it's part of our tuition and our fees. But I never went once. I had a locker at school and a gym bag with gym clothes, but I never went. And now I regret it because now it's COVID and we don't have that choice anymore.
Yeah, but I feel like honestly, not having that choice has also forced me to find like other ways to work out, even at home. And I feel like there's been a really drastic increase of at home workouts, especially on YouTube with like Pamela Reef, Chloe Ting Challenge, Mad
Yeah.
Fit, like all of these like YouTubers, fitness YouTubers, just posting these at home workouts. I think the Chloe Ting, like, ab challenge has, like, over 20 million views on YouTube just because everyone has been turning to these, like, YouTubers to, like, work out at home.
Because it's definitely hard to just get started on your own and just do like push-ups and stuff. But if there's like someone on YouTube kind of to guide you and to help you, and then you know a lot of people are doing it too on the way, it definitely is a more like motivating factor. I know a lot of people who did the Chloe Ting challenge
Yeah.
over quarantine.
And I feel like there's also so many different options other than the gym to, like, do exercise. For instance, you can just simply go out on a stroll or even just roll out a yoga mat and do, like, 5 minutes of meditation. It doesn't require, like, a lot of space or time or money, and just working out at home is, like, much safer.
Yeah, it's definitely much more safer just because when you're working out, you don't have to worry about catching COVID if you're at home.
Mhm.
I know this is a bit extreme example, but I know that like my cousin, he got really into fitness like a year ago. And so when the gyms closed, he was like devastated, but his parents are like super, super strict about COVID. So he ended up actually building an entire home gym and starting an Instagram fitness account to motivate him to work out and just to work out at home. And it's honestly been working for him. Like he likes that option.
Wow, that's amazing how he, like, used this, like, I guess in his perspective, not so, like, happy turn of events, but he turned it into, like, a source of, like, inspiration to build his own gym.
Yeah,
Wow.
like I was surprised. I went to like visit my family and then I just noticed the home gym. I'm like, so you have a home gym now?
That's so lucky. Wow. That's so
He
nice.
yeah,
Mhm.
he got a lot of extra free time just because with COVID a lot of people who used to work at like different places like restaurants and stuff got laid off. So he used that extra time to just focus on fitness still and build his home gym and make sure that it has like all the different like things that he wants. He still misses the actual gym, but for him this is at least an option. Like he can work out safely without leaving the comfort of his home and risking like getting exposed to COVID.
Wow, that sounds amazing. And I feel like another factor to consider is, like, what should we label as essential in, like, these businesses? Like you said earlier, how, like, LCBO and beer stores are still open, but gyms aren't. I feel like a lot of these petitions are focused on, like, should we make gyms an essential business? Like, asking that question.
Like I see the argument where like gyms are really good for mental health and physical health, and there's also people who have like lost their jobs due to this, like people who work at gyms. Like I know a couple people who work at like Good Life and Fit for Less around the city, and they've been really like against the closing. They argue that if they reopen gyms, that will allow a lot of people to return to work, so a source of income. And personally, like mental health is important too, especially during this time. And the fact that schools are still open too is a big argument.
Yeah. Honestly, that's so true. I'm really shocked how schools are still open, but, like, restaurants and other local smaller businesses are forced to close.
Because if they really want to limit their exposure, I feel like they could do school online. Like university students, at least in Ottawa, are doing it mostly online. Like I only know one person with one in-person class that happens like once a month. That's optional. But for my siblings in high school, I literally like hear them talk about going to school and it's so weird to me. Like they're like, "Oh, I saw my teacher," or I'll talk to her in the hallway. I'm like, "You guys like you guys go to school in person, right?"
Yeah, and that's, like, such an easy way for COVID-19 to spread. And I can definitely see from the perspective, like, of a fitness worker why it's super frustrating how, like, schools are still open, but and beer stores are still open, but gyms are closed. Like, it seems, like, kind of unfair from that perspective, but it's really, like, considering, like, both sides, like, the labeling of, like, essential versus non-essential and how, like, people can get other sources of exercise from, like, outside environments or from their own house. Like, there are both pros and cons from the situation.
Like personally, I feel like yes, like alcohol is good, but also like we don't need it to be open. That kind of thing. It's not I wouldn't see it as essential, but I feel like the fact that the government kind of sees it as like essential enough to stay open is a bit risky. But the thing is that there's less spread, I guess. Like you can't really spread COVID as much as you can in like beer stores compared to gyms, but also like the school thing's really risky because my sisters go to two different schools, and in both their schools there's confirmed cases, and they
Whoa,
still haven't
really?
like yeah, like both of them. Like one is a really big school, and then one school with like I think 1,000 or like 700, 800 people, and then my other sister's school is like around 500 people. But they both had COVID cases, and it's kind of concerning in a way that like the city's just kind of like we're still gonna keep them open. And like I even remember like I saw the email and they're like, oh yeah, there's one confirmed case, but don't worry, like that kind of
Wow,
thing.
that's so bizarre because I haven't heard a lot on the news focusing about how like school transmission has occurred. Of course, like there were like 1 to 2 news articles of how like a couple of teachers had to self isolate because of these COVID cases. But I feel like the majority have been just like they haven't really been like media centered, like these COVID cases in schools. However, like in gym breakouts, they're often like immediately covered by the media. Like, oh, Good Life on like Strandherd just got a COVID case and the whole gym closed down and that kind of thing. So definitely I think media coverage also has an influence.
Yeah, and I feel like that's really frustrating for people who work in gyms. They're like the media's kind of cherry picking on who they want to cover just so that it confirms like with a certain bias, which is bad, which is really like frustrating to see. Because
Mhm.
if there's one like case in a gym and like everything shuts down, then why isn't it the same for a school?
Yeah. So definitely both like sides have arguments for like essential and non-essential businesses. And I think um overall like mental health as we mentioned before, job opportunities and all these things are deeply impacted by COVID-19, not just for the fitness industry but for all industries across Canada. And cases of obesity are also impacted by COVID-19. And we've been seeing a rise throughout the decade of cases of obesity, as well as during in quarantine.
I definitely have been caring a bit about my weight more because of quarantine, just because I feel like I've been doing so much less exercise, and my diet isn't as good. Like I go for more easy things now, just to avoid going to the grocery store as much. So it definitely has an impact, and I do see like I feel like rates will increase, but it's not really anyone's fault if it increases. I remember I saw like a post like one celebrity he got like a lot more chubbier during quarantine and people were making fun of him, but also people were defending him by saying like let him live like it's quarantine, that kind of thing. Like this happens to everyone.
Yeah, that culture of like body image and like shaming, fat shaming on like social media is definitely extremely toxic. And I think that's everything today regarding obesity and gyms. Before we go, make sure to show some love for your favorite podcast by leaving us a review on Apple Podcasts or giving us a like on Spotify. And stay tuned for our next week topic podcast on youth and substance abuse. And thanks for listening to Healthcare Signs and Symptoms today. And have a great day.